Ladies and gentlemen, diabetes is a huge public health challenge. It affects over 36 million adults, as well as around 300,000 children and young people in the EU. Around 1.6 million of these people live with type 1 diabetes. Overall, the numbers are rising rapidly. In fact, they have nearly doubled over the last 2 decades. The impact on people with diabetes and their families is significant. Having to manage a chronic condition and being at higher risk of additional health problems. But the EU is taking action. For the first time, we are developing an EU cardiovascular health plan, which will be adopted by the end of this year. The plan will pay particular attention to diabetes and obesity, as they are closely related to cardiovascular health. This plan will cover prevention, early detection and screening, treatment and care, including rehabilitation. And it will have a special focus on developing health checks for diabetes and cardiovascular diseases to identify people at risk. The plan will provide a blueprint and support to guide national action. It will encourage more digital, innovative and personalized solutions. We will take advantage of the opportunities offered by the new technologies and artificial intelligence. We also want to address the gaps we see in research and innovation and the inequalities that exist among different member states and among different groups of the population. We have been consulting citizens, member states and stakeholders on the plan so that it is developed in a collaborative way, and so that it reflects the experiences and expertise of those it is intended to help. We will also build on the action we have taken up until now. For instance, the EU's Healthier Together initiative. This supports member states and stakeholders in addressing non-communicable diseases and their risk factors. Through the EU for Health funding program, we have supported work on cardiovascular diseases, diabetes, and factors that increase the risk of developing these diseases. We also support projects promoting healthy lifestyles and tackling diabetes in children and young people. These projects have a strong emphasis on prevention, early detection, screening, and raising awareness. In the coming year, we launch a €20 million flagship initiative leveraging artificial intelligence and health data for cardiovascular health and related non-communicable diseases. This program will support the development and deployment of artificial intelligence applications to advance risk prediction, prevention, treatments, personalized care, and rehabilitation for diabetes as well. Ladies and gentlemen, the 14th of November is World Diabetes Day. This is the day to emphasize the importance of all of us working together and to be open to use new technologies, both now as we develop the EU Cardiovascular Health Plan and when we put it into action. We're counting on your support. Thank you for your commitment.